Hello, everyone. So, lately I have a lot going on in my life. A lot of thoughts that have crossed my mind. So, as a physician, I'm trained to diagnose people, to treat people, to make a differential diagnosis once I'm given some clinical information, such as symptoms that patients have, objective data, and then um, as soon as somebody who is not even talking to me talk about this information or give me that information, my brain is trained to process that into a differential diagnosis and then start working on it and what it could be, what would be the disease. You know, that's how we all are trained. Like, especially our training is so robust and so hard. Automatically, your brain defaults to that. However, almost for about 1.5 year, I've been struggling with a lot of fatigue, generalized fatigue, unspecified fevers, brain fog, extreme insomnia, and lately I developed extreme pain in my wrists to a point that I was wearing night splints, thinking to myself that, oh, it could be just carpal tunnel syndrome because I've been working so hard, I've been typing, and I've been sitting on the computer for so long. So have been doing that. Nothing got better. And I just kept working night shifts, day shifts, 100 hours a week, and despite having all these symptoms. One day, I was sitting on the table, and my son was sitting with me casually, and he saw me wearing those night splints and say, "Hey, what's going on?" And I'm like, he's 12 years old, by the way. So I told him like roughly about my symptoms and how I've been struggling with all the symptoms. I said, "Hey, how about if a similar patient with your complaint, with same age group, presented to you in the hospital, what would you do for that patient?" And it was such a thought-provoking moment for me. I never thought of myself as a patient, and I was dismissing my symptoms, was totally, ignoring whatever I was suffering through, and I thought it's all burnout phase. It's all like I'm extremely tired. I'm extremely fatigued. So obviously that thought stuck with me. I called my PCP and requested them to send a referral for rheumatologist, and sure enough, some antibodies were ordered, and I had very high levels of anti-CCP. These are the antibodies which are very specific for rheumatoid arthritis, and my inflammatory markers were off the roof. I was started on a medication, and it's been almost a week and a half that I've been taking medication, and I'm not been feeling the greatest, but I believe that it will work soon. So this whole situation made me think that why did I ignore my symptoms for so long? My colleague physicians and people who are in healthcare, generally, we go through very robust training. Our exams are very difficult. Sometimes we study for 18 to 19 hours. And, while we are studying for all those exams, while we are going through this intense residency training, we are struggling with parenting at home. We are struggling with heartbreaks. We are struggling with diseases. We are struggling with death of a loved one. But it's a part of our training that we just work through all that. We put a facade on our face, and when we see a patient, we forget everything, and patient becomes our priority. We are so used to dismissing ourselves. That exactly happened in this case, where I was helping so many people, diagnosing so many people, but I just was blaming everything on my fatigue, my work schedule, my new job, and whatnot. So what I learned is that listen to your body. If your body is telling you something, listen to it. Yes, half of it is burnout, half of it is fatigue, but think from that perspective that if somebody of your age would come to you, how would you treat them? What would you do for them? Take care, everyone.